And eventually, we roll out finding out, the problem is humongous. And it wouldn't be easy just to address the treatment pieces. We should look at building the capacity of the community to address the prevention and promotion. Huge immigrant waves comes to Toronto, and then we find out the mental health needs is great, and the existing treatment and medical model would not be able to address the needs of the huge population who are facing the stigma, who are facing lack of resources, lack of knowledge and skills to address the emotional and mental health related issues. So Hong Fook eventually see that opportunity and then feeling that it should be a good direction to address the prevention and promotion pieces, particularly through the capacity building and leadership training. A lot of people, they might want to come out to do the volunteer. They felt there's mental health needs, great needs, but they don't know, how to address it. Through the volunteerism, it was an effective way that we roll it out with the training first before they can do the volunteer, and then equip them with the knowledge and the skills, and then they eventually can join us together to promote mental health.
The Peer Leaders Program was actually initially started more than 10 years ago when we got a funding from the government to do a research or a project. Because by that time, the communities that we are serving are the Vietnamese community, the Cambodian community. They are actually very war-stricken communities. They are refugees. So they actually came here as refugees and bring a lot of trauma, a lot of aftermath effects there. And so we did a research on what their needs are. So starting from that, and then they found that the model of empowering them, because empowerment, capacity building, and community engagement are the values that Hong Fook embrace. So that starting from them, and then they develop a whole range of training curriculum to deal with their own issues. And so that after the training, they themselves are the ambassadors to go out and then work for us. So they are teaching people how to self-manage their chronic disease. And after they learn how to do it, they deliver the message and knowledge to other people with the same disease.
The idea is really building volunteer leaders to do health promotion in the community. But on top of that, they want to build engagement component in the project where we invite our partners agencies to come to support the project as well. Because there's a need for them to have volunteers that speak different languages. And that's why they gave us the support, and this is why they send a volunteer to the project to get the training, or if they don't have volunteer to send to the training, we actually recruit volunteer on their behalf and then place those volunteers at the agency afterwards. And last year, we trained approximately 45 participants, and one training is on English, one training is delivered in Mandarin. This year, we're doing 4 languages. This year, we delivered training in Cantonese, Mandarin, Vietnamese, and Korean. We use a holistic health approach. We truly believe that in order for someone to be healthy, mental health is one component, but physical health is another component. That's why when we recruit a supporting agency, we recruited agencies such as the Cancer Society, the Heart and Stroke Foundation, the Kidney Foundation, and the Liver Foundation. So what they did is when we build the training curriculum, they come in and supply us with their training material as well. And then, so what we did is we put together all the material together with a holistic health approach. So after they finish the training, for example, they can be gold placed in Liver Foundation, for example. So Liver Foundation has a health fair. They can use our participant, and then the participant can help us to host their promotional booth. One thing that we're really proud this year, and I believe one of the success stories we can share with you, is that in the Level 2A training, every training has 6 sessions. And one of the last 2 sessions, we actually turned into a practicum. We divided the participants into 5 different groups, and they worked directly with the staff from the representative agency. And each of them learned how the agency trained the volunteer into health promotion. So afterward, the last session, the participants come back and do a presentation on their own. and then they revise, they give suggestions as to how to revise some of the current material, more specifically target to the Asian community. And that exercise, that practicum, was very, very successful because it's a new idea we created, it's a new idea we implemented, but it's the most well-received training session we got so far because they get to use what they learn when they actually deliver their own presentation, because the participants create their own presentation. It helped them build their confidence level. And then you should see some of the ideas, some of the presentation, they're very, very creative, and then it actually exceeded my expectations. But the idea is, for the goal in the whole project is really to develop true volunteers who can take a leadership role and then pass on the skill set to the next generation. So volunteer leader will train the next set of volunteers and will train the next set of volunteers, and this whole project will be self-sustained after 3 years.